I wanted to talk with you all about, we have a policy now from NIH, and the question is, there's a lot of policy you can do, but there's a lot of policy you can't do. And so what are the tools available to funders outside of the mandate itself? And so I have had the opportunity to serve for 3 different research funding organizations, including the NIH. I'm at the ALS Association now. I'm going to give you a big picture. And we've also are lucky to have Ashley Farrelly here from the Bill and Melinda Gates Foundation to talk about her experiences with their data sharing work. And we have Mary Rose Franco, who's the executive director of the Health Research Alliance, of which the association is a proud member, to talk about how lots of other health foundations are approaching this problem. And so I do want to talk about this from literally from a big picture. This is a painting that's on the ceiling of the Great Hall of the National Academies. And if we could actually have met in person, I would have invited you to go and look at it. But since you can't, here it is. And you see Prometheus reaching for fire. And Prometheus is with his patron, Athena. She's got her little owl, her shield, and she's carrying a stick. And with her big stick, she is not hitting anyone, but she's using her stick to guide Prometheus. And she's saying, and I'm paraphrasing, Prometheus, if you take this fire, lots of great things will happen for humanity, and it's a non-rival good. Don't worry about it. Taking the fire is a good thing. And then there's this wonderful quote, which is also on the ceiling of the National Academies building from Aeschylus, which talks about all the great things that happened to humanity because Prometheus shared fire. We had the creation of culture, we had the creation of science, we had the creation of medicine. It was an undeniably a good thing. So it's really interesting to me that the Academy of Sciences painted a myth on their ceiling, and this is the myth they chose. And so what happened to Prometheus? Well, this is a picture of a piece of ceramics, I think from the 6th or 7th century BC. It's in the Vatican Museum. And you can see that Prometheus has had his arms and legs bound. So he's fettered, and he's got a bird who comes to him every day to eat out his liver. And he's suffering because he shared fire, and Athena is nowhere in the picture. She's not there to help him. But Prometheus is not alone. He's with a colleague. In this case, it's Atlas. But of course, Atlas has his own burdens, and Prometheus is not getting any help from anyone. So this is really interesting. And I've been in this space now talking about data sharing for a while, and things are changing. And so every conversation I've had about data sharing for the previous 10 or so years always came up with this concept of theft, that if I share my data, someone is going to steal my science and I'm going to lose out on opportunities. And this is the first time I've been to a big meeting to talk about data sharing where that really hasn't come up at all. And I think that's a big victory for this community, in part because so many of you that have been involved in these discussions have made that point that that's not really an issue. But it's a very, very old idea. And that's not to say that there aren't complex legal and ethical issues that need to get resolved. And Kristen's session, I think, highlighted some of them in detail, but there's a lot there. And I was heartened to hear a comment yesterday, I think from David, that one of the things that we should be thinking about is to be guided by, how did he put it? Respect and generosity when we think about data sharing. So this idea of theft is going away, but we're still in an era where data sharing is viewed as sacrifice. So if you share your data, it does limit the things that you can do. It takes time and resources away from other things. Even if your funder is willing to fund the data sharing activity, oftentimes these grants have ceilings on them, so you have to make choices. And in the case of NIH, many years, even when you get the grant, they have to take additional money back to adjust the budget. So there's always limitations, and yet people still manage to share their data. And there are many folks here who've done that. And I think that's also a wonderful thing. One of the exciting things from the NIH policy is we're shifting the idea of data sharing from this sacrifice, that's something that special people do because they're doing something unusual, to an obligation. And we have this principle embedded in our culture and science that didn't start, but evolved over a number of maybe even centuries, that science isn't really science until it is publicly shared in a rigorous way. And we had a presentation yesterday talking about, even though everyone agrees with that principle, even though it's written into our definitions of research that it has to be intended for public dissemination, that it doesn't happen all the time. And sometimes it's because it's hard, because people don't want to do it. And sometimes because people don't actually want to publish the science. It's too trivial. But we do have the expectation that data should be shared. And this policy is making that expectation tangible. But there's still a difference between publication and data sharing, in that we have many, many systems to value publication, and we don't have those systems in place for data sharing. And so what I think we would like to get to is the idea that sharing your data or your resources is just as honored and valued as publishing your work. And then there's as much opportunity for credit, for promotion, for advancement if you share your data well. And we all know that doesn't exist yet. So I want to talk about how we could get there. And there's really two groups of people. So the first is the scientist. We have to recognize full effort is never covered by grant support. I don't know a single academic who doesn't spend evenings and the weekends either reading papers or editing papers for journals or doing review or writing grants. That's just not covered. That's things they do. And the other person I want to focus on is the program official, because the way the policy is written, they have huge discretion in what's adequate, what's not adequate. The unit is having an adequate plan, but it's really hard to define what it is. And they're working in a space where NIH covers multiple disciplines with different cultures and expectations of what good data sharing is. And the program official is caught in the middle of that. Are they representing NIH to the scientist? Are they representing the science to the government? And they have opportunities to have their own opinions in that and not be consistent. And so the right set of incentives for staff, I think, can help lead to a more consistent, perhaps more effective policy. So I'll talk about these in turn real quick. A simple way to make data sharing universally accepted is to consider reserving part of the biosketch, part of the NIH application, specifically for data sharing or resource sharing. So right now, you put in a biosketch, you're allowed to include up to 5 of your most significant contributions. They could be data, they could be publications, but they're almost always publications because we have a culture that doesn't value data. If we change that, where you get 4 to do whatever you want with, and 1 that has to be about resource sharing or data sharing, it does set more of a level playing field that everyone is expected to be sharing data. That's relatively cheap to do, but of course, not necessarily simple to do. For an agency, a funder like NIH or parts of NIH like an institution, or even an association like mine, how do we get them to have credit for data sharing? So we can certainly count data sharing plans, but that's not the same as shared data. And NIH has created really sophisticated tools to track the impact of their funding. And so you can go to a project, a specific grant, and with that grant, you can find associated publications and patents and clinical trials and sometimes even press releases. But we don't have a tab for shared data or shared resources. Now, I wouldn't know how to build that tab with the way that these things are constructed right now, because we don't have consistent usage of digital identifiers and so forth. But if we started with that intention, then that gives the agency another tool to build, or another incentive to build more rigor into their data sharing plans. So there is a way to support sharing from a mechanical and automated perspective. And then you can start to aggregate this information across different portfolios and different institutions to see what data are being shared. And then, so that's at the agency level, but what about at the portfolio level, where an individual staff person is managing an area of science, and how do we get them to track not the fact that we have plans or the data sets are shared, but the value of that sharing, the impacts of that, the papers that come from that, the additional grants that come from that, and of course the science that really changes health. That's a much harder question. And I'm concerned that if we ignore that question and we focus on the things we know how to do, if we essentially look where the light is, we may miss the point, and we will just create a bunch of plans and get a bunch of data sets shared that people aren't using. And so I would encourage NIH and all of us to use the time up to 2023 to think hard about what the real impacts of the policy is that we want, and how to measure them in a systematic way. So we really can get at the portfolio managers who know how to do this well, who help the scientists that they work with to do this well, and elevate their disciplines. So just to summarize before we shift to Ashley, we are in a cultural shift. We're moving away from data sharing as a sacrifice that people take on by themselves to an obligation, and we need to quickly shift out of obligation and bureaucracy into something that people want to do because it's something that they feel is recognized. And so we can build some little tweaks into our application system. We may be able to build some tweaks into our reporting system. That's harder, but we really do need to think harder about how to measure the downstream impacts of data sharing. So with that, I will stop sharing my screen and turn things over to Ashley to talk about experiences from the Bill and Melinda Gates Foundation. And please write your questions into the chat, and we will have time for that later.